Hi friends, today we are going to discuss a very important and a little tricky topic which generally people skip to study because the information of this topic is little haphazardly arranged and we don't get the information in a crisp and concise manner. The topic is cephalosporin. Cephalosporin, we can say it is a monster topic. So today I just concised it in only 2 pages for you so that you can get a clear idea about how to study the cephalosporin with every information you should remember. So this is the way of doing cephalosporin. You just have to remember or you just have to learn just 2 pages. That's it. It is so simple that cephalosporin are categorized or classified into the 5 generations: first generation, second generation, third generation, fourth generation and fifth generation. That is very much easy. Okay, so let's see the drugs of the each generation cephalosporin. The example of the first generation cephalosporin is cephalothin, then cefazolin. The example of the second generation is cefoxitin, cefotitan and cefuroxime. Then the example of the third generation cephalosporin is cefoperazone, cefotoxime, ceftriaxone and cefixime. And the example of the fourth generation cephalosporin is cefepime and cefopyrome. And the example of the fifth generation cephalosporin is ceftaroline, fosamil and ceftobiprole medocaryl. So these are the example. I know this is not that much easy to remember, but you will get to know or you will remember it by practicing it 2 or 3 times. Okay, you can remember the first generation, it is easy: cephalothin and cefazolin, simple. Second generation, cefoxitin, cefotitan, you can remember like that. Third generation is important group. You should thoroughly mug up or thoroughly read the drugs used of the third generation. Then fourth generation, 2 easy one: cefepime and cefopyrome. And fifth generation not that much important, so I have not written the information of the fifth generation also. These 2 example you can remember. By this way you should remember the name of the drug, and we will see the information about every generation cephalosporin. First of all, what about the their action against the gram positive bacteria and gram negative bacteria. With gram positive bacteria, first generation cephalosporin is the most active generation of the cephalosporin used against the gram positive bacteria. As we go forward, the action of the cephalosporin will be getting decreased or reduced towards the gram positive bacteria. That is, first generation will be the most active against the gram positive bacteria. Second generation will be less active against the gram positive. Third generation will be lesser active against the gram positive bacteria, and fourth generation will be the least active against the gram positive bacteria. Exactly opposite is about the gram negative bacteria. As we go from left to right, the action of the cephalosporin will increase for the gram negative bacteria. That is, first generation is the least active against the gram negative bacteria. Second generation is lesser active against the gram negative bacteria. Third generation is less active against the gram negative bacteria, and fourth generation is the most active against the gram negative bacteria. So this is the way it will be acting against the gram positive and gram negative bacteria. What about the Pseudomonas and Salmonella? So against the Salmonella, first generation is not effective, second generation is also not effective, third generation is effective. Cefoperazone is moreover used against the Pseudomonas group of bacteria. Then fourth generation is also effective. If you say first generation and second generation both are not effective against the Pseudomonas, then what is the difference? The difference is that the first generation is not effective against the Bacteroides fragilis, but in the same case second generation is active against the Bacillus fragilis. So Bacteroides fragilis. Then third generation is against active against the Bacillus fragilis, but the fourth, it will be active or effective against the Pseudomonas but not against the Bacteroid fragilis. Okay, this is against the Pseudomonas. Then against the Salmonella, first generation again not effective, second generation is not effective, third generation is effective, and fourth generation is also effective. So this is the way we have seen their activity, or they are the effective against the gram positive, gram negative, Pseudomonas and Salmonella. Then are they resistant or susceptible to the beta lactamase enzyme? Depending on that, we will see the difference in the generation of the cephalosporin. First one, the first generation, cefazolin is susceptible, only cefazolin is susceptible, and in the second generation, cefuroxime is only resistance, and in the third generation, whole drugs are resistance against the beta lactamase enzyme, and in fourth generation is also resistance against the beta lactamase enzyme. Then are they crossing the blood-brain barrier or not? The first generation will not cross, second generation can cross the blood-brain barrier, third generation can cross the blood-brain barrier, fourth generation can cross the blood-brain barrier. So these are the different point or differences about the cephalosporin different generation, first generation, second generation, third generation, fourth generation. So you can write the difference, and you can now you know the lot of information about every generation of the cephalosporin. The more important information of the single generation is their use or their therapeutic use, which disease they are going to cure. The first generation uses are they can use for the skin and soft tissue infection by Streptococcus and Staphylococcus, and they can be used against the surgical prophylaxis. You can remember by SS, skin and soft tissue infection and surgical prophylaxis. Then second generation are used in the respiratory tract infection like otitis media and sinusitis. Then intra-abdominal and pelvic infection may also use. So these are the uses of the second generation. You can remember like R O S I. Okay. Then after that, third generation, you know our triad UTI, that urinary tract infection, respiratory tract infection, GI tract infection, the three, and the second group syphilis, gonococcal, meningococcal. If you follow cotrimoxazole, fluoroquinolone, then after that penicillin, and now cephalosporin, this sequence is same: urinary tract infection, respiratory tract infection, GI tract infection, then STD, that is syphilis, gonococcal, meningococcal, and then typhoid fever also the same. The two peculiar are septicemia and nosocomial infection is different. So this is the therapeutic uses of the third generation. After that, the fourth generation use is hospital acquired resistant infection. Fourth generation is used for the hospital acquired resistant infection only. So these are the uses of the various generation of the cephalosporin. So by this chart you can remember all the information about the cephalosporin. The adverse drug reaction of the cephalosporin is combinedly I will tell, like hypersensitivity reaction, skin rash, urticaria, itching and dermatitis, gastrointestinal tract infection, nausea, vomiting, diarrhea and anorexia. Then pain at the site of intramuscular injection, nephrotoxicity, tolerance to alcohol and severe bleeding are the various adverse drug reaction of the cephalosporin. So by this way we can learn the cephalosporin by just writing it down in 2 pages, or you have now you can screenshot this, and if you just revise it for the 2 or 3 times maximum. First of all, you watch the video, you revise it now at this same moment only, then just give a one revision in middle, then give the one revision before the exam. You will definitely remember all the points about the cephalosporin, and that will be easy for you instead of going through lot of theoretical information in the book. You should read the book at least once for the very same topic or any kind of topic. Read and just take the information which is useful and important for you, and by that you can frame your own answer and you can get the marks in your exam, and you will easily remember this information by looking it 2 or 3 times. So just follow this 1 or 2 pages of the chart, and get the cephalosporin done. Okay, Thank you.